academic leadership, and human compassion. Currently serving as Director of Breast Health and Oncoplastic Surgery at Northwestern Medicine, she has dedicated her career to advancing modern breast cancer care with precision and empathy. I would like to call upon you, Madam. May we have a few words to start the presentation?
Very good. All right, well, thank you. I want to thank all of you for taking out the time out of your schedule and giving us the opportunity to speak to you all today. It's truly, we are humbled by the opportunity, and we look forward to questions and sharing and collaborating with all of you as well. I try to tailor my discussion today towards the surgical audience. My understanding is that we're in the company of surgical trainees and surgical colleagues. So what I really wanted to focus in on was oncoplastic breast surgery, which is something that I personally am passionate about as well. And so what we'll do is discuss what oncoplastic surgery is by definition, and then what we'll talk about is where it's indicated and contraindicated. And then we'll dive into the surgical approaches specifically related or that fall under the umbrella of oncoplastic surgery. And again, we'll revisit some indications and contraindications, and at the end we'll talk about the pros and cons of utilizing an oncoplastic approach, and then hopefully at the end there will be some time for discussion and questions. So oncoplastic surgery has been around for several decades. I will tell you though that not every surgical practice in even the States is equipped to offer oncoplastic surgery services. It does require additional training. So typically in the States, you'll do a general surgery training followed by a breast surgical training, and then certain fellowships will be catered towards providing additional oncoplastic surgical training as well. If you do not have the oncoplastic training yourself, then you will collaborate with a plastic surgeon to offer the services typically. But the concept is that you are combining both plastic and reconstructive techniques with oncologic breast cancer surgery. So when you're applying it in the breast conservation surgery setting, what you're basically doing is you're rearranging the local tissue in the breast following that oncologic operation, which is a lumpectomy. And your goal is to basically preserve the breast shape and contour, and also have a secondary goal in mind, which is cosmesis. The primary goal will, of course, always be oncologic. And then often there is a contralateral surgery that is done at the same time to give them a more symmetric outcome. Now, when you're applying oncoplastic surgery to a mastectomy operation, this is more in reference to applying the nipple and skin sparing approaches, which have been the mainstay for the last 2 decades at least.